What is this? What is this? And who are you? I don't know if you gave me all my pills. You'd be like, these are the same pills you've been taking for the past 25 years. Nothing has changed. Here are your pills. Hi everyone, thanks for coming back to my channel. I am your fave nurse B. Let's get into this video. So today I'm going to talk about something I have not really touched on at all on my channel. But I'm going to talk about being a CMT, like what does it entail, and then I have some tips for you all. So I did talk to a few CMTs at my job. I myself have not actually been a CMT before, but there has been times when we've been short on CMTs and they had us pass meds. And then also I've worked night shift, and when you work night shift you have to pass your own meds, so it's basically like being a CMT when you work nights. So yeah, let's get into the video. So basically a CMT is a certified medication technician. And basically what they do is they pass all the medications for the patients. Now this is, sometimes there's some facilities where they don't have them, some states don't have them. You might, as a nurse, you might have to pass your own meds, you might not have to pass your own meds, you'll have a CMT do it. So where I work at, long-term care facility, the nurses do the treatments and call doctor, do all that good stuff, and the CMTs hand out all the medications except the narcotics. The nurses do the narcotics or controlled substances. There are some controlled substances that CMTs do, but it's like a certain they call it a schedule, like it's a certain grouping that they can do, and there's a certain grouping that nurses have to give out. So that's that. Along with giving medications, you have to make sure that you check the medications to the patient, make sure you're giving out the correct medications, make sure you're looking at the orders, making sure the order is on there properly. I mean, really the nurse is the one that's making sure the order is in there properly, but like as a CMT, like if there's something you see, you're like, wait, this person's allergic to this, so why are they taking this type of deal? That's something that you will alert the nurse about. So that's that. So I want to give you all some tips. I will say, being a CMT is no joke. I remember the time I had to pass meds, it was like you get no freaking break. Like, because in my job, like you pass to like 50 plus patients. It's crazy how many medications you have to pass. And if you're on a day shift, you're passing day meds, early morning meds, and you're passing like lunch meds, and then sometimes there's meds that you have to pass right before you leave. Like, you have no break. People come to you and they ask for PRN medications, which are medications you can get as needed. So you already gave them their schedule. Now they come back behind you and like, hey, I need a Tylenol. You're like, okay, I gotta stop what I'm doing, give you a Tylenol. Like, it can get, whew. And the cart that we use at my job is huge. It's like it's a huge cart. It's probably like my wingspan of how long it is, and big, and it's up high, and you have all these medications on there. Now some facilities, they have like, oh gosh, what is it called, where the machine is just, it opens up, a Pyxis? Yeah, a Pyxis, where you put in the patient's info and you put in like the time you're giving it, and like it just pops out what that person needs for the day, and it'd be like in these little like pouches. At my job they do cards, so it'll be a card of meds, and you have to punch out each pill that you need, and at the top it'll tell you like the physician order, like take 1 tab by mouth QAM every morning, that type of deal. So that'll be on there with the patient's name, and you pop them out and you give them. It can get really crazy because once again, you have to make sure that you have the right, there's all these different rights when it comes to medications, but the right patient, the right medication, you know, the right time. And you're constantly looking at that as you're giving out your pills. And if it's like a floor that you don't work usually, and it's all new patients, you have to be like, okay, so who is who, and who is who, and what's her name, and hold on, wait, I need to give her her meds, don't take her there. Like, it can get real crazy. So let me give you all some tips as far as like how to do well as a CMT. I talked to a few CMTs at my job. Like I said, it's a rough job from what I've seen, because I think the med pass at my job is just ridiculous, but that's that. Because some people can get like 20 meds, like legit 20 meds in one freaking like pass. Like, that's a lot. 20 medications and you have like 50 patients, that's too much. Anywho, so one tip that I got from a CMT is start from the beginning and work your way down. So what they mean by that is you start from the beginning of the hall. At my job, we have a huge hall, and there's like 2 wings. Like, there's a huge hall all the way down coming onto the floor, and then there's like 2 halls on the side. She's like, just start at the beginning and just work your way down. Like, just do that and just go from patient to patient, versus kind of like some people, they'll start their med pass like in the dining room. we have 2 dining rooms. We have a main dining room. We have a dining room on our division, which is for people who need more assistance with eating and things like that. So they'll start down there passing out everybody. Okay, she's sitting down. Okay, I can just get her pills. She's sitting here eating. Da da da. Do it like that. But then you're like, okay, wait, did I give her pills yet? Because if you're doing paper charting, that's a whole nother thing too. But with computers, you can get an idea of, okay, you know what, I gave her pills, cool. But when you're doing paper charting, you have to keep track of who you gave pills to, because you're not going to remember, I gave these 15 people their pills in the dining room. So when I go back to the rooms and start giving out pills, okay, yeah, I know I gave her hers. Like, you might not remember that. So you have to have like some type of system to remember it. At my job, when we did paper charting, we had like these little flags, like it was in a binder, all the different orders, and there was like this plastic insert that divided everybody's orders, all the paper. And then it was a tab you pull up, and you could pull that tab and it can kind of be like a reminder to yourself, okay, it'll just flag right outside the book. Like, it'll just flag like this outside the book, but it'd be like a little plastic piece that'll flag, and you'll be able to be like, okay, I gave her this, I gave him that, okay, cool, boom, moving on to the next one. But that's not always the case, so you might have to write it out, whatever the case may be. But you have to find some type of system to know who you gave medications to and whatnot. But when you have computer charting, you can go and just kind of punch everything out as you go. As you're punching out your pill, okay, I gave her that, boom, boom. You know, you just keep doing that and getting medications. Which, giving the medications is a whole other thing. So the tip that she said, another tip was, she was like, if you have to crush the meds, because there's going to be like, hopefully there's going to be something on the order or like in the MAR, something somewhere, like a little addition or note there that'll say takes meds crushed, takes meds whole, takes meds crushed in applesauce, something like that, to give you an idea. Because some patients, they can't swallow their meds, or they it's harder for them to swallow their meds, or they just like them to be crushed. That's just how they like it. Or they don't want it to be crushed, but they still want it to be whole, but they want you to put some applesauce or pudding in it so it's easier to go down, that type of deal. So look at those, okay? Find out how these people take their medications. It's very important, because you can sit here and look at somebody and be like, she's on a parade diet, which is like a baby food consistency diet, in case you don't know, and be like, she take her pills crushed. And then you crush these pills, put them in some dang on applesauce, and they looking at you like, I take my pills whole. And you be like, really? And you didn't crush my 15 pills. And you're like, okay, well, let's just take it. She's like, no, I take my pills whole. Whole? No. But you know what I'm saying? You gotta go back and pop out all these pills and give it to the person. Like, when you could have just looked at the note, or maybe asked somebody, how do you take your pills? And when you do give it crushed, and this is something I used to do. Like, I feel like, because when you crush them up, they'd be like in a little bitty medicine cup. You put the applesauce or the pudding in there. It'd be like a huge heap of freaking pills. I'd be thinking, okay, let me just divide it up in two. She was like, no. When they are crushed, just give them the whole scoop. Just take all of it and give it to them. Especially if it's somebody who don't like to take their pills. Like, just give them the whole thing, because it's going to be harder for you to get that second bite in there and have them finish some pills, versus just putting it all on one thing, throwing it in there, and then just giving them something to drink. Giving pills can be a mess, because you have to actually deal with the patient, and they may or may not want to take it. They might be asking you, so what is this? What is this? And who are you? I don't know if you gave me all my pills. You'd be like, these are the same pills you've been taking for the past 25 years. Nothing has changed. Here are your pills. But you know, you got to be like, oh, yeah, that's your atorvastatin. This is your da-da-da. This is that. This is that. You know, like, you got to go through the whole meal, especially if you're a new face. Because I mean, you gotta think about it. You're a new face. They don't know if you're giving them the right pills. They don't know if you know what you're doing. So they're gonna look at you kind of sideways, like, because this is medication. Like, this can mess me up here or there, or this can, you know, prevent me from having my blood pressure where it needs to be, and I'll be end up in the hospital. Like, it's, so they kind of take it serious, especially if they're lucid. They take it serious. Like, okay, are you giving me the right pills, type of deal. So, you know, communicate that, know what pills you're giving. Of course, you're not probably gonna know each pill. Like the little yellow one with the M on it, that's that. No, you might not know that. You might have to go back to the cart and be like, okay, this is the pill that you got for this, and the third, this type of deal. It is what it is. Like I said, it can be a beast. But I'm gonna do a video talking about the pros and cons of it. So look out for that. It's not completely horrible. There are some pros to being a CMT. So the next tip she said is if somebody refuses their medications, then try to give it to another staff member. So this has happened. Some people be like, I don't want this, I don't want that. And then I'll go in there and talk to them. I'm like, okay, so are you gonna take your pills? Like, why you don't want to take your pills? I don't know if she's giving me the right pills. And then I'll check them, okay, here, these are the right pills, here, take your pills. Or they'll be like, I don't want to take that because I have diarrhea and that keeps giving me diarrhea. I don't want to take that pill today. Okay, that was the issue versus them saying I don't want to take any of their pills. They just don't want to take that one pill. So sometimes communication is a big deal, and just having a fresh face there could be a big deal, especially if you have patients who have dementia. Like sometimes they just need to see a different face and they'll be more willing to do what you need them to do. So that's that. But don't just throw them away. Be like, hey nurse, or hey such and such, can you try to get this patient these pills? Especially like if the family is there and you might want to wait and, you know, be like, hey, you know, I tried to give mom her pills with breakfast and she wasn't taking them. I still have them. Do you want to, you know, try to give them to her? That type of deal. You just watch them give it to them. It's not a big deal. That can happen. Like, because sometimes they might not want to take it from you, but they'll take it from their daughter, you know. They like to play games. So that's that. And then another one is to, y'all, make sure you stock your meds behind yourself, like, because you'll go and you'll be like at the end of the card and you pop the last pill, put that card to the side and make sure you go back and you find where, you know, because in my job, like the pharmacy might bring 2 cards of something. So like say they bring 2 cards of I don't know, Xanax, and you pop the last Xanax. We have an area in our actual med room where we store any overflow of medications. So you'll keep that card, like, okay, boom, I popped the last Xanax. At the end of your med pass, you'll be like, okay, let me go in the med room and see what I need to, you know, restock. You got your whole little bunch of cards that are empty, and you go in there and you go, okay, boom, I got the Xanax, I got this, I got that, boom, put it back on the card, you good. Make sure you do that because there's going to be somebody come behind you. There's going to be an order for Xanax. They're going to be looking for the card. They're going to be all the way at the top of the hall, and they got to stop what they're doing, come all the way to the med room, get another card for the Xanax. When you could have just did it at the end of your shift. Like, it's common courtesy, you know, like, I hate having to do that. That is a pain, a straight pain. Because best believe it's not going to just be one patient. It's going to be like 5 patients you got to stop and go look for medications. I hate that. Anyways, make sure you order meds. So say you, okay, pop the last Xanax, you go to the med room looking for the card and there's no Xanax. Call the pharmacy, whatever your facility has for you all to order it. You can order it through the computer on my facility, and you can call as well. But order that or talk to the nurse like, hey, she's out of this Xanax. She's been on the Xanax for the past 2 days. I don't know what they've been giving her, if they've been giving her Xanax. They just been saying they've been giving it, but it's none nowhere to be found. It was none when I left 2 days ago. When I come back today, it's still none. I ordered it. I don't know why it's here. Can you call the pharmacy for me, nurse? And the nurse will call. But I mean, their CMT can call too. But it is, them CMTs be busy, y'all. I'm like, I'm not gonna lie, they be busy. Ooh, I know they be busy. That's a job, honey. Pay attention to the names and the meds. She was like, you have to pay attention. Like, you have to focus yourself on what you're doing because it's super, 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 super important. These are people medications. It's the stuff that's preventing them from going to the hospital, preventing them from dying, from having issues, from having behaviors, from having pain, all that good stuff. So pay attention. She said just make sure your card is matching, the name on the card is matching the name in the computer, or the, you know, the MAR or the TAR. MAR, I should say. MAR is the medication administration records, and that's like the paper form of medication orders. That's what we used to have. We called it a MAR. But anywho, make sure everything is matching up, because you don't want to, sometimes we all human. You might take a card and the person might have the same exact name, last name as somebody else, and you might accidentally put that person's card, you know, in with somebody else's meds. And if you just pop in like, okay, you know, whatever, and not really paying attention, like, you could give somebody the wrong medications, medication error. What if they're allergic to it? What if they have, you know, any type of issues from it, or it interacts with another medication negatively? Like, that's a med error, and that's something so petty. Like, you just have to look at everything and make sure it's good. So that's why when you are a med tech, you need to kind of get in the zone and focus on what you're doing, because what you're doing is very, very important. Sometimes you need to talk to your patients before you give them their pills, because you might see, like, changing condition happens really easily in nursing homes, but also like in hospitals too. Like changing condition happens super easily. So a patient that was able to take meds whole yesterday, today they kind of talking a little like weird, or maybe they like a little bit more confused. Time of day changes how people act, how they might take their medications. A lot of things can change. So she was like, make sure you kind of talk with them beforehand and kind of get an idea of where they are mentally. And sometimes talking to your patients, they're like, oh wait, make sure you don't give me this because, like I said, I'm having diarrhea, so I don't want that pill. That's something you ain't got to pull. You can put refused or whatever. Patient refuses, says she has diarrhea. Keep it pushing. That's one less thing you got to deal with if you talk to your patients first. Or when you talk to them, they're like, hey, can you give me a PRN, da da da. Versus you popping all the pills, taking it to them, and then they're like, can I get a PRN? You got to stop and go get another PRN and come back. Like, it's too much. So she was like, talk to your patients first, because you might see like, okay, this person is not going to be able to take these pills. And then you alert the nurse like, hey, yesterday she was able to take her medication. She was talking to me, and right now, I don't know what's going on with her, but it's not, she ain't right. She can't take these pills. So then that right there is the communication you have to have with the nurse and the CMT. Like, it has to be some type of communication. Like, it makes a big difference. Your job is super important. CMT is like, oh my gosh, I hate passing meds. Like, ain't no way, y'all. To make sure that you look at the drug that you're giving and the person's allergy, because yes, physicians will order something that a patient is allergic to. Now this might be because they have like a mild allergy to like this antibiotic, and this is the only antibiotic that's going to treat them. So we're going to take the risk of giving them this antibiotic and take the risk of them having some type of mild interaction with it versus them not getting what they need to clear this infection. So, but it could be the case that the doctor didn't even notice it, the nurse didn't notice it, and they're on something that they're allergic to. You have to alert the nurse, who then can alert the doctor and go from there. But just pay attention to allergies and what you're giving your patients. Pay attention, get in your zone, get some type of system going for yourself. Like she said, start at the top of the hall. Do whatever you have to do to kind of make some type of system, and just know that passing meds is a beast. Don't get me wrong, but once you start knowing your patients, talking to them, getting an idea of like, okay, this person always asking for a PRN. Let me just go ahead and pop this PRN and give it to them before I even go in here. Like, you get to know them, you know what they need, what they want. You know that this person, if you come in here at 9, they're not going to take these pills. They want to wait till after they eat to take their pills. Okay, cool. So you know that you ain't got to waste your time going in there. Get to know your patients. Get you some type of rhythm going. And that's that. Now, that's long-term care. Now, of course, when you're in a hospital, people come and go. It's completely different. But with the computers, you got to watch yourself, because at my job, we have a liberal pass, meaning that they give you like for morning meds, you get from like 7 o'clock to 11:15 to give morning meds. Boom. But some places, they still do it where if something is due at 8 o'clock, you have from 7 to 9. So you have an hour before and an hour after to give them those pills. So you have a 2-hour window versus the 7 to 11:15 window, which is way bigger. It's a literal pass, because like I said, we got like 50 patients. Because if something is due at 8 o'clock for 50 patients, 2 hours is probably still not enough time for you to give everybody all their meds. Like, yeah, it just ain't. It's just too much going on. And yeah, so y'all gonna stop and do this and the third, like, you're probably gonna be late, and everything gonna be red on your computer. I know at my job, everything goes red when you're late. I'm sorry, I'm sitting on, yeah, I'm tired. I had this baby, I'm tired. Yes, baby girl is here, yay. Anywho, thank you all for watching this video. I hope you found it helpful. If you have any questions, let me know. I'll ask some of my CMT friends about it. I'll probably try to interview a CMT. I gotta find one that's willing to do it. But let me know if you have any questions down below. Let me know, are you passing meds? Do you like passing meds? What is some things, some tips that you have? Put them in the comment section, because I know people need help with it, because like I said, passing meds can be a beast. It can be a beast. All right, you all. Thanks for watching. Peace.